Hello students, in today's video I am going to discuss some reasoning question and answers. These questions has been asked in some university exams in Madhya Pradesh. So here you can see that it is the university paper of Madhya Pradesh Medical Science University Jabalpur, and this exam was held this year only in March 2026 in the supplementary batch. Now when you will see this paper, in this paper there was a section named as reasoning questions. Now these questions are carrying the 4 marks. There are total 5 questions. So it is a 20 mark section. Now in these 20 mark section you can see these are the 5 questions. Now what are these questions? A patient with enlarged prostate has difficulty in urination and back pain due to the spread of cancer to the vertebrae. Explain the anatomical pathway of the spread. Question number 2. A child presents with the swelling in the groin with that increases on the coughing and decreases on the lying down. Explain anatomical basis of this type of hernia. A fracture of the pelvis lead to the rupture of membranous urethra in a male patient. Explain anatomical basis and consequences. A patient receives an intramuscular injection in the gluteal region, later develop the foot drop. Explain the anatomical basis and its complication. After the injury of surgical neck of femur, there is a avascular necrosis of the head of femur may occur. Explain the anatomical basis of this complication. So dear students, there are these 5 questions, each question carrying the 4 marks. So it is a section of 20 marks. So let's discuss every question one by one, that how to write or how much to write in exam. So dear students, this is the question number 1 about the prostate cancer. Now you have to keep this thing in mind, that question is asking about the metastasis. Now in the metastasis there is a spreading of cancer cells from the primary source. Now whenever we are talking about the prostate cancer, you have to understand that the venous plexus around the prostate is having the connection posteriorly. So first the prostatic venous plexus is connected with the vesical plexus, and posteriorly these vesical plexus will go and drain into the internal iliac vein. But in the posterior side, along with the internal iliac vein, there is a connection with the internal vertebral venous plexus, and that's why the cancer cells from the prostate metastasize or migrate with the help of blood route, not by the lymphatic route. So now there are 2 parts in the question. If you will read this question, the one part is there is a difficulty in urination, and second part is back pain. So you have to write down about both the things. So how to write down? The prostatic venous plexus, it surrounds the prostate gland. It communicates with the internal vertebral venous plexus, which is known as Batson's plexus. So this prostatic venous plexus posteriorly, where in posterior aspect, communicate with the plexus inside the vertebral column, and there is a spread of cancer cells. Why? Because this connection is not having any valve, so it is a valveless connection, and it allows backward flow of the blood. So the cancer cell is spread throughout these veins to the lumbar vertebrae and pelvis. Now why there is a pain occurs? Now there is a one question is also there, back pain. Now this pain occurs because whenever there is a metastasis occurs in the vertebral column, it may causes compression of the spinal nerves, and that will lead to the back pain also in the prostatic cancer. So because of the enlargement of the prostate gland, it may compresses the urethra, so there is a difficulty in urination. Plus this metastasis compresses the spinal nerves, that is the cause of back pain. But how these metastases will take place? That from the prostate there is a deep connection with the vertebral venous plexus, which is a valveless connection. So the cancer cells from primary site enters inside the vertebral column. Clear? So this was the first question. Now we move to the next question. Now in the next question when you will read the question, you have to keep one thing in mind, that here the key feature is that it is a child which is present with the swelling in the groin, and this child age group is an indication that whenever we are talking about the types of hernia, you have to keep this thing in mind, that child is always having the indirect inguinal hernia. What type of hernia? Indirect inguinal hernia. So this groin swelling increases on the coughing, and the child most likely have the indirect inguinal hernia. Now this is the important thing which you have to write down in the bold letter. Now what is the anatomical basis of inguinal hernia in a child? Now you have to write down one important embryological component that is known as processus vaginalis. So during the development, the processus vaginalis accompanies the descent of testes. You all know that lower part of processus vaginalis form the tunica vaginalis, and the remaining part disappears. But if this processus vaginalis persists in the child, that will lead to the indirect inguinal hernia. So if there is a failure of the closure and leaves a persistent passage between the abdomen and inguinal canal, that means there is a failure in the absence of processus vaginalis. Now this will lead to the contents to protrude through the deep inguinal ring, then they will pass through the inguinal canal, and they may enter into the scrotum. So dear students, there are two key features in this question. First is the age group, because it is a child, so definitely you have to think about indirect inguinal hernia. And second, the hernia increases, the swelling increases with the coughing, so it is suggesting that it is a reducible hernia. So you have to write down about the processus vaginalis. Now we'll move to the next question. The next question was about the injury of membranous urethra after the pelvic fracture. Now when you will talk about membranous urethra, now in this question the one point is not clear about the status of perineal membrane. So because the perineal membrane is not cleared in the question, we are supposing that the perineal membrane is intact. So now you have to keep this thing in mind, that your perineal membrane is intact, the membranous urethra is above the perineal membrane, and your penile urethra is below the perineal membrane. Now the injury occurs in the membranous urethra, that means above the perineal membrane. So because the perineal membrane is intact, the status of perineal membrane is not given in the question. So the superficial perineal pouch will not have the collection of urine. So urine will collect in the area above the perineal membrane. Clear? So this concept should be very clear in your mind when you are writing the answer of this question. So let's discuss what are the things you have to write down. So fracture of the pelvis may rupture the membranous urethra as is given in the. So what are the anatomical basis? The membranous urethra passes through the urogenital diaphragm. What is the name of diaphragm? Urogenital diaphragm. And here in this diaphragm, this membranous urethra surrounded by the external urethral sphincter. So definitely when there is an injury, the external urethral sphincter will also damage. Now it is firmly fixed and therefore easily torn during the pelvic fracture. So in membranous urethra, why it is more prone to the injury? Because it is a fixed part. So it is not movable. So whenever there is an injury occurs through the fracture, this part will get damaged. So what are the consequences? There is an extravasation of the urine inside the deep perineal pouch, around the prostate and bladder, and it may be present into the perineum, but it will not come into the superficial perineal pouch, it will not come into the shaft of the penis, it will not go into the anterior abdominal wall, it will not come into the front of thigh, it will not go into the scrotum. Because these all area will have the extravasation of urine if there is an injury of perineal membrane or if there is a rupture of penile urethra. But because it is an injury of membranous urethra, so you have to write down the basically there is a collection of urine deep side. Deep side means around the bladder, around the prostate. Clear? So this is the question which you have to keep this thing in mind, that if there is an injury of membranous urethra, the superficial pouch will not have the urine, the deep pouch will have the urine. The next question, intramuscular injection is given in the gluteal region and it is leading to the foot drop. Now this is the easy to understand, because when you will have the gluteal region, we divide this gluteal region into the 4 quadrant, and this upper and outer quadrant is the safest quadrant for the intramuscular injection to avoid the nerve injury. But in this question, what is happening, that the improper injection is given into the lower and inner or medial quadrant. So in this quadrant, the injection has been given. Now here you will have a thick nerve is known as sciatic nerve. So when there is an improper injection is given in this quadrant where you have the sciatic nerve, the foot drop occurs because there is an injury of the common peroneal component of sciatic nerve by this injection, and it is going to supply the muscles of your dorsiflexor. So these are the muscles of the front of leg. So because the common peroneal nerve is get injured here, it will lead to the foot drop. Clear? So how to write down here? The sciatic nerve, it emerges below the piriformis muscle and run through the gluteal region. There is an improper injection in the lower and medial quadrant which may damage the nerve. Now common peroneal part of sciatic nerve is often affected. The paralysis of the which compartment? Anterior compartment muscles of the leg, and this will lead to the loss of dorsiflexion and the consequence is foot drop. So you have to write down in such a way when you are writing the answer of this question. The last question of this reasoning is, fracture neck femur causes avascular necrosis. Now avascular means when there is a decreased blood supply, it will lead to the necrosis of that part of the bone. Now here you have to keep this thing in mind, that this is the head of the femur, this is the neck of the femur, and this is the shaft of the femur. Now whenever there is an injury in this neck of the femur, what will happen? The blood vessels are passing into the head through this anterior surface of the neck. Now these branches are basically known as retinacular branch, and majority of the branches arises from medial circumflex femoral artery. These are the, what is the name of branches? Retinacular branches. So you have to keep this thing in mind, that these vessels run along the neck of the femur beneath the capsule, and what is the name of branches? Retinacular branches of medial circumflex femoral artery. So fracture neck femur tear these retinacular arteries and the blood supply to the femoral head reduces or cut off, and it will lead to the avascular necrosis of femoral head. Clear? So I hope now this is the way that you have to write down the reply of these reasoning questions in your university exam, so that you will get the good marks whenever such questions will come. So this is all for the session. Thank you and bye bye.